For this video, I'm going to be demonstrating wound care, irrigation, and dressing. So we have my patient here. As you can see, she has a dressing over an abdominal incision because she had abdominal surgery 2 days ago. So I already demonstrated how to set up a sterile field. I have clean gloves here on my hands. I'm going to remove the dressing. If it was taped, I would just peel it off. If the dressing was stuck to any of the sutures, the wound, or the surrounding skin, I would take a little bit of saline and just squirt it on there to help pull it off. So we have our dirty dressing. We can dispose of that. And at this point, I would now remove these gloves. Pretend like I'm removing the gloves and don some fresh gloves. So I have my fresh gloves on. To irrigate the wound, I'm going to take a syringe. Now anything that needs to be sterile, let me see if I can open this. Anything that needs to be sterile needs to be dropped into the sterile field. Can open this with gloves on. Okay, so we'll put our gloves back on. So when I open the package from the top, I'm just going to drop it into the sterile field like so and get rid of the trash. If I had saline, I would fill up the syringe with saline. And then to irrigate the wound, I would start from the top, just squirting a little bit down to the bottom of the wound. And then I would also have a towel over the patient so that the patient doesn't get soaking wet in the process. I could also use some gauze pads with some saline in it to clean the wound. I would start far away from me at the top and just wipe from the inside out, closer to me, and then away from me, and then go on the other side. Now, to redress the wound with a sterile dressing, we'll pretend like this was not opened. Same way to open up all sterile packages from the top. I would rip it open and drop it onto the sterile field. And then redress the patient's wound. However, it was ordered by the doctor, and I could also use some of my own discretion. Thank you.